So this project is called Healthcare Support and Strengthening in the Gambia, and it has three main focus areas. The first is on revitalizing the primary healthcare within the country. And here in the Gambia, one of the major burdens of diseases are infant diarrhea and pneumonia in children under age 5. We went into these communities because we wanted to show an example of what some of the issues are that these communities are faced with. It was joyous. They did a lot of dancing, and it was very celebratory. They were very happy to have us there. But it was hard to see. It was hard to see that, these communities don't have access to clean water. That these children, they're drinking water from open wells where it's clearly, even visibly contaminated, and they have no other water sources. Or that they don't have any proper means of sanitation or waste disposal. If they do have latrines, they are collapsing because they aren't built to the highest standards. And it's very, very frustrating to see that children are dying of diarrhea or of pneumonia that are nearly entirely preventable.
Soul Health is a public charity registered in the U.S. as a nonprofit. It has what's called 501c3 status. It was founded in June of 2016, basically to respond to requests of other entities to establish and maintain health promotion and disease prevention strategies for the populations they serve. The Gambia Red Cross Society approached us nearly 2 years ago requesting assistance to establish a health promotion and disease prevention strategy in the process of also revitalizing their primary healthcare system. So they submitted an application, and our board approved it.
We've partnered with the Gambia Red Cross Society, and they have over 20,000 volunteers throughout the country, so we have the human resources. It's a 5-year project. We are starting in the URR and the CRR, which stands for the Upper River Region and the Central River Region. And these two regions are the furthest regions from the coast. They are the ones that have the most need for care, the most limited resources.
Yeah, these two regions, they need our intervention as quickly as possible, because CRR and URR, that they are indicators on the health is all red. When I say red, means they are all down. The indicators are very poor in terms of health. So they didn't have access to basic amenities, health amenities, like basic health care facilities, and also materials that are needed to improve the health system in those regions.
We're a small organization, so we're really unable to say yes to most because we also have some very strict criteria that are designed to ensure that we put our efforts into truly making a difference at the grassroots level. Those criteria are: does the request delineate a project that is in fact feasible? Is it likely to be sustainable?
We aren't interested in just coming and giving people temporary solutions. That whole saying, give a man a fish, he eats for a day, teach a man to fish, and he eats for a lifetime. Will our partners, or those entities that come and apply to us, will they agree to share the results with anybody that asks?
And this came about after visiting many health facilities at all levels, from the village level all the way to the Minister of Health and tertiary hospitals, and working very closely with the Gambia Red Cross Society, who invited us, as well as a small German charity called UB1.
We live in a globalized world, but we don't really act according to it. So whatever we do, more than ever, we have a huge impact on our planet. And if it's on the environment or if it's even on other people. I think it was never a time that it was so important to more come together to find solutions in one table and not come with the idea of you're underdeveloped and I'm developed, or I have the right strategy in order to solve our problems, right?
Partnership. Partnership is very important. If you look at the SDGs or Sustainable Development Goals, SDG 17 calls for partnership. This is projects are dynamic and it calls for expertise from different areas. So it's something that no one area can do. So partnership will be very crucial in this project. That's why we're here. One of the reasons is to talk to partners whom we will be working with and so that the project is successfully implemented. So partnership will actually be very key.
All eyes are on the Gambia, and the whole world, they're watching it. And so we feel that now, even though it's a very small country and we're a very small NGO, and this project, won't meet the needs of the entire country, even though it will be in the entire country, we feel confident that should it succeed and should we be successful, other entities will likely replicate it. And that's the key, because we want to plant a seed and then watch it grow.
Having worked in the government at high levels and worked on the ground as a primary care physician in remote areas, and working in public health at various levels in between, I've come to believe that the most effective way to make public health change is to invest wisely such that the project succeeds and will be replicated. So anybody who donates to Soul Health, whatever project we do, can ensure that their donation will multiply as a result of other entities copying what we put in place. People are free to donate their funds to anyone they want. But if they're interested in making a donation that will essentially multiply itself, then Soul Health is the place to donate.